what is known as communicable disease, and the other part is the non-communicable disease. So what is the basic difference between these two types of disease is that in the communicable disease, the disease can spread from one person to another person by any route, be directly or indirectly. Whereas non-communicable diseases are those diseases which are restricted to that particular individual. Okay. Now, among the communicable disease, the most important or most of the communicable diseases are also known as infectious disease. Now, infectious diseases are caused by an organism which is normally not associated with human body. Sometimes may or sometimes may not. Okay. So, broadly speaking, it is caused by organisms which are more or less alien to the human body. Now, there are two aspects of management of any case of human disease. The first aspect of management is to treat the patient. The second aspect of the management is to prevent the spread of the disease from one person to the another person. Okay. Now, how can we prevent the spread of infectious disease? First of all, we need to restrict the passage of the pathogen to the new host. And the second part would be to increase the immune status of the other host, who are non-infected host, so that they do not get the disease. They may get infected but will not get the disease. That job is mainly done by vaccination. Okay. So in today's class, we'll basically try to understand how the communicable diseases spreads and how we can actually prevent other than the use of vaccines. Now let us look at the principles of the disease transmissions. The first is we have to understand the chain of transmission. So whenever a disease is being spoken of, so there must be a source or reservoir. Now what is a source or reservoir? The source is the origin from which the infectious agent comes in contact with the human body. Then you need a susceptible host. Please give importance to the word susceptible host. I have already told you one aspect of prevention is use of vaccine or raising the immune status. Any patient who has a heightened immunity will not be susceptible. In this case, we are talking about susceptible. So what happens is that the person acquires the organism from the source, and when the organism gains access into the susceptible host, it causes the disease. And finally, all infectious agent needs a mode of transmission. So what is the mode of transmission by which the susceptible host gains the organism from source or disease? So if we do understand this chain of transmission, we can interrupt the flow from source to the host. Now how can we do that? First, we need to understand what is the source. Now for infectious agents, the source can be people. A patient is admitted, his patient's kin, the friends, family, they may be visiting. They may be the source, or the patient himself or herself, or the patient is incubated. And one more word, that is the patient may be colonized. Now try to understand what is colonized. That means the patient has the organism in some part of his body, but he is not getting infected, or he is not diseased. He just only has the organism. However, when this person comes in contact with another person who may be susceptible, will cause the disease. The other source would be environment. Any contaminated surfaces, contaminated equipment, everything that is present in the hospital environment may be a potential source of the organisms. And finally, a very important aspect you must realize, the human body is not devoid of microorganisms. We as living beings have evolved along with other organisms, and our body also have numerous organisms. Normally they do not cause disease, but in certain case scenarios they do cause the disease. In that case, the source would be the patient's endogenous organisms. Okay. Having understood the source of transmission, let us look at the mode of transmission. What could be the mode of transmission? First is contact transmission. What is contact transmission? It could be directly or it could be indirectly. A very good example would be what is known as Staphylococcus aureus. Staph aureus is a gram-positive cocci. It causes numerous infections and it is also present in the normal skin of all human beings. But there is one variant of Staphylococci which is also known as methicillin-resistant Staphylococcus aureus or MRSA. So basically this variant is resistant to most of the antibiotics that we use for treatment. Now what happens is that some patient may have this MRSA strain in their body like anterior layers. Okay, now this person goes on picking his nose and now the organism is in their fingers and then shakes hand or touches another person. That person will now get this organ. And if he or she is susceptible, might get the disease. The other would be droplet infection. I think you are very much aware of droplet infection, obviously because of the recent pandemic that has occurred. Now, whenever, what is droplet infection? Whenever a person sneezes or coughs, small droplets come out to the nose and mouth. Now, generally, these droplets are more than 5 micrometer in size. Now, why this is important? Because anything that is more than 5 micrometer in size, the probability of that particle being suspended in the air is very less. And it is seen that generally about 3 feet distance, it will settle down on the surface, the little ground. However, if the size of the particle is less than 5 micrometer, the probability is that it will remain suspended in the air. And that is what we call as airborne transmission. Now, what is the importance? Try to understand the implication of this thing. For example, if a patient has measles, he coughs or sneezes, the virus is present in very small particle. So, suppose in this room, if there is one patient who is coughing or sneezing, he will be transmitting that organism in all the air in this whole room. So, whether he was sitting about 10 feet away from the patient or 20 feet away, it doesn't matter. But in case of droplet infection, if you maintain certain distancing, you get yourself protected. Okay? Try to recall the precautionary measures that were given by the government of India during the COVID pandemic. Can you recall? Whenever the people were standing in line for any kind of activity, they were told to stand at least 1 to 2 meters away from each other. That was the preventive measure for droplet infection. Okay. Then what are the standard precautions? Now it is also called as universal precaution. Now, by definition, standard precautions are a group of IPC practices. IPC means infection prevention and control practices that are applied to all residents. The resident over here means all patients. Okay, everyone, not only patient, even healthcare worker, regardless of suspected or confirmed infection status. That means whether you know or you don't know what is the status of the patient, whether the patient is having any infectious disease or not, may have an infectious disease, may not. Maybe the patient is coming for an elective surgery. Maybe the patient is even coming for an OPD consultation. Whatever the case may be, this is the minimum level of precautionary measure that you must take at every step in your life. That is called as standard precaution. Now, what are these practices? These practices include number 1, PPE. PPE stands for personal protective equipment. I think you have all heard about PPE. It was extensively used during the COVID pandemic. Next is hand hygiene. Please recall, I have already told the most important mode of transmission is direct contact. Most of the time, healthcare workers will come in contact with the patient by using their hands. So, hand hygiene is very important. The second part would be injection and medication safety. I'll come to it in detail much later. But injection and medication safety is not only for the patient but also for the healthcare workers. Third would be respiratory hygiene and cough etiquette. This is predominantly targeted for droplet and airborne transmission. Okay. Next would be environmental cleaning and disinfection. Third would be reprocessing of reusable medical equipment. Now, if you look at all these things, the first is to protect your own self. That is to protect the healthcare worker. Hand hygiene and rest all are done to stop the infection from spreading by interrupting the mode of transmission. Like hand hygiene, that is direct contact, respiratory hygiene and cough etiquette by airborne and droplet infection. Injection safety and medication practices. Some diseases are transmitted by parenteral route. A very good example would be HIV, hepatitis B, and C viruses. So all these will come under injection safety and practices. Now, if we look at the last two part, environmental and reprocessing of medical equipment, this is to reduce the source of organisms. Now, another is transmission-based precaution can be taken based upon organism-wise, syndromic-wise, or location-wise. You don't need to muggle up all these things. Try to understand what is. First is organism-based. I have already given an example of MRSA. Okay. So how can we proceed for these precautionary measures? Suppose a patient is admitted in a surgical ward, it's been planned for an elective surgery. Okay. And while tracing the patient, we find out that this patient is harboring MRSA strain. Now, when we know where to find this patient, and then we can specifically act on that patient for prevention of spreading the MRSA from that patient to other patient throughout his stay in the hospital. That is when we look at organism based. The other way would be syndromic presentation. For example, Clostridium difficile causes Clostridium difficile associated diarrhea, and this can spread from one person to another. So obviously, a patient which the patient is remaining in the ICU and is having diarrhea for a prolonged period of time. So the patient is suspected of having Clostridium difficile infection. So if that kind of syndrome is presented, we can take precautionary measures at first. Okay, that is how our approach should be. Let us look at all the precautionary measures one by one. First would be personal protective equipment. What are the things that you should need? First is gloves. Second, protective eyewear. Whenever you are trying to do any kind of procedure which may cause or result in a splashing of body or body fluid, you should always protect your mucous membrane. So what are the mucous membrane? The nostrils, the mouth, and the eyes. For the mouth and the nostril, you must wear mask, and for eyes, you must wear a protective eyewear. Please remember, all those of you who are having spectacles, spectacles do not protect your eyes from splash. Okay. Next is an apron. Why it is required? Because any kind of splash will not contaminate your own clothes. Finally, a gown. After wearing the apron, you must wear a gown whenever you are expecting a splash of body or body fluid or blood. Similarly, your boots, try to make it a habit whenever you are entering into the hospital. Please do not wear any sandals or this kind of footwear. Always try to wear covered footwear, preferably made of leather, so that your skin does not come in contact with any body or body fluid. And finally, you should try to have a cap or hair cover, especially for females who are having long hair. So these are the essential parts of the personal protective equipment. Second part would be hand hygiene. What is hand hygiene? It is the process of cleaning hand by using hand washing, antiseptic hand wash, or antiseptic hand rub, or surgical hand asepsis. So why is it important? Obviously, it prevents the spread of pathogen directly or indirectly, and from hands of healthcare worker transiently contaminating during patient care. Also removes the pathogen. This is very important. Hand hygiene protects both the patient and the staff. Normally, as healthcare worker, we try to overlook or only perform hand wash whenever we are dealing the patient. Otherwise, we are not. Please remember, hand washing not only protects you but also protects your patient. Now, there are three types of hand wash. First is alcohol-based hand rub. Now, why alcohol-based hand rub was introduced? So, hand washing, see, washing means using water and soap in simple terms. But many a times, you tend to attend the patient who do not need any kind of procedure, or you are not touching the patient thoroughly. Furthermore, hand washing takes a lot of time. Suppose you are attending the patient in the ward, you have examined one patient. Again, you need to go to the basin, wash your hands, dry them, come back, then only you can move on to the next patient. So it becomes a very tedious. Easier alternative is to use alcohol based hand rub in the meantime. The advantage of alcohol is that alcohol acts as a dehydrating agent, so any pathogen will be dehydrated, denatured. Furthermore, alcohol evaporates, so you don't need to wash it. So it takes a very little amount of time to use the hand. Generally 20 seconds is required. Next is hand washing. When is hand washing required? And when you should not do alcohol based hand rub? First is whenever your hands are visibly contaminated, any organic matter. Remember, alcohol will not act on organic matter. So if your hands are visibly soiled, get your hands washed. Next, when you have exposure with patients with infectious diarrhea or C. difficile or an outbreak. Outbreak means a patient is suspected of having infection with a notorious organ. Always prefer hand wash. Obviously, this is very true for each and every person, whether a medical person or not. You need to wash your hands after using the restroom and before and after eating food. Finally, is hand scrub. If you go to the operating room, you will find that the surgeons and the nurses involved in the surgery, before going into the surgery, wash their hand rather extensively up to the elbow. Why? Because hand scrubbing is even more thorough case, washing thoroughly the skin of the hands. The objective of washing your hands before surgery is to remove the resident flora. That means your hands will have microorganisms even after you wash your hands like you do normally. So surgeons need to scrub. That's why it's called scrub. Scrubbing means using soap, water, and mechanical force to remove the resident flora. Why? Because whenever a surgeon is, suppose a laparotomy is going on, this resident flora may contaminate the gloves that the surgeon is using and hence gain access directly into the bloodstream. So even commensal organisms will cause bloodstream infections. So this is called as hand scrub. So I think you have understood. Hand hygiene involves three parts. One is hand washing, then is alcohol hand rub, and third part is hand scrubbing or surgical hand washing. Okay. Now coming to the training, obviously all people whenever entering into the hospital, whether a doctor or nurse or a technician, must be trained for these standard precautions and they should be retaught every year. Okay. Next part is injection shift. Now this is a very important part, especially for the doctors and the nursing personnel working in the ward or other area. So what are injection safety? It is a set of practices to perform injections in a manner that is safe for patient, staff and others. Okay. Please try to understand the patient, staff and others. Why? I'll explain. Now what are the recommended area? In the ward or wherever, even in outpatient, There must be a designated clean area for preparation of the injections. Normally, you will find that the medicines come in vials and ampoules, and from that vials and ampoules, they need to be uh, put in the syringes and then pushed into the patient. This whole procedure must be done in a clean area. Okay. There are many ill practices like preparing the medicine on the bed of the patient. These practices should not be done. Next is adherence to aseptic technique. Whenever you are using, please remember when you are injecting a patient, your method should be aseptic. You cannot introduce an organism because of your own carelessness. So, whenever you are opening a syringe, always remember you should not contaminate it. Then proper use and disposal of injection equipment. Why disposal is important? Obviously, suppose you have given an injection, say intravenous injection, and you have just left the needle outside. Any person walking may get a prick. So disposal is very important. Next is proper identification and handling of medical containers, and a very important part is beyond use date. What is beyond use date? You will find that many medicines will come in ampoules and vials. What is ampoules? A single use small glass container are called ampoules. Whereas vials are the large container in which multiple use can be done. Now, I think you all know that medicines should not be used beyond the expiry date. That is fine. But suppose there is a vial, okay, say xylocaine used for any local procedure for anesthesia. So a 40 ml xylocaine vial has can be given to numerous patients on multiple occasions. You have opened a vial of xylocaine today. How long should you use it? So the expiry date is uh, 1 year or 2 years later on. How long should we use it? The answer is anything that is opened should not be beyond 28 days or according to the manufacturer requirement. Whether you have any drug left or not, you should not use beyond that. This is called as beyond use date. And obviously, the medicine should not be used beyond the original expiry date. Okay. So these things you should keep in mind. Otherwise, what happens is that whenever, say in a vial, multiple drugs are taken out, the chances of the drug itself getting contaminated gets higher and higher. Another important part is drug diversion. What is drug diversion? Any criminal act or deviation that removes a prescription drug from its intended path from manufacturer to the patient. Basically, drug trafficking. So you should also be aware of any kind of illegal activity that might be going on in the hospital settings. Okay, I'm not going to learn more in pharmacology. Coming to respiratory hygiene and cough etiquette. So this must be done for any person with signs and symptoms of respiratory disease. So, what are the respiratory disease? Cough, congestion, rhinorrhea, increased respiratory secretion, or patient having fever. So, what are the important features? Is the source control measures and spatial separation. Spatial separation means to keep those patients at least more than 3 feet away from each other. That is the spatial separation. Then there must be proper education of the staff, patients, and visitors. If you go to a hospital, even in the outpatient department, you will find many leaflets regarding respiratory hygiene. This is put out for the visitors to learn about respiratory etiquettes so that the patient, they may come along with the patient might having a respiratory illness. They also must be aware about respiratory hygiene. Then visual alerts with instruction must be given for patients and visitors. Next part is environmental cleaning and disinfection. This is a very important step. Why? Because any contamination, waste, bodily waste, or any other waste, if present in the hospital setting, might be a source of infection. So that must be clean. Now, frequency of cleaning will depend on the setting. In the emergency room, it is very difficult to clean the emergency room periodically, because obviously emergency room is for emergency purposes and very high traffic is going on. But let us suppose the ICU. It's a much more controlled environment and much more critical environment. So proper cleaning should be done at regular intervals. So depending on the setting, there are separate recommended methods. What you should also know what is known as terminal cleaning. Terminal cleaning means a patient is suppose admitted in a ward or ICU, and what would be the outcome of the patient? Either the patient will get better and get discharged, or the patient will get worse and ultimately may succumb to the illness and die. So, whatever may be the outcome of the patient, when the patient leaves that particular setting, terminal cleaning is done. Now, this terminal cleaning is even more thorough than regular cleaning, so that no pathogen of the previous patient is allowed to, for the other person who is coming in, to be exposed. Now, another important aspect you should understand is what is known as low touch surface and high touch surface. As the name suggests, what are low touch surface? Sorry. Whenever you enter, suppose you enter into the ward, there will be some areas which will come with human contact more frequently than other things. For example, the bed railings. People will have the habit of touching the bed railings of the patient, or say the patient stand where the files and documents of the patient is kept, or say the medicine stand that is kept beside the patient. They will come in contact with the hands of the healthcare workers more frequently as compared to other areas, say the walls or the windows. Okay, so because they are high touch surfaces, they need to be cleaned much frequently or more frequently than the low touch surfaces. Another aspect I'm just highlighting the important part is water management. Why? Because there are many organisms which are transmitted by water. Now, for understanding the water management, what you must understand is three parts. First is upstream. Upstream means, say, any building which has got a water supply will have three parts. First part, there will be a water storage facility, generally a water tank in the building. There will be a plumbing system from which the water is pumped to the water tank, and from that the water is used and then it is discarded in the form of sewage, right? So these are the three parts. So contamination can happen at three areas. One is upstream, that is from the water source it may get contaminated, or there might be a contamination or any poisoning going on in the water storage system itself, or it could be in the downstream, that is during the point of use and the discarding sewage. So these are predominant in the department of engineering or the architectural department, but you must be aware of all the waterborne diseases that can cause outbreaks. Another important would be aspect is linen management. Whenever the patient is admitted, the patient will have bed covers and other linens or gowns the patient may be wearing. They are also exposed to this organism. So, if you look at this cycle, what happens after the patient uses the linen? The dirty linen is collected, stored, transported, and then it is sent to the laundry for washing and disinfection. Then the clean linen is again stored and supplied. There is a clear demarcation between the red and blue lines. What I am trying to make you understand is that after washing and disinfection, care must be taken so that they do not get contaminated. Okay. So these two parts must be separated. Now, in the hospital setting, furthermore, you will read about what are known as the hospital or healthcare acquired infections. So there are particular set of healthcare associated infections. Those include the urinary tract infections, surgical site infections, ventilator associated events or pneumonia, and vascular infections like catheter related bloodstream infections. So for them, we have separate set of preventive measures known as bundles. Okay, we'll learn it furthermore. I'm just giving you the open idea. Another important aspect is wound care. Especially in the surgery ward, you will find there are many types of wound, like a pressure wound, or a diabetic or vascular wound, or a surgical wound. Now, why this is important? Because these wounds, they may or may not be infected, and sometimes even an uninfected wound may become the nidus or the source of a pathogen for other patients. Okay, so what should we do? We must take skin and wound infection surveillance. Surveillance means to look for which type of wounds are infected. Then we must evaluate the wounds, whether the infection is spreading or not. Then we must follow the standard precaution. Obviously, we need to treat the patient, but following the precaution. Next part is point of care blood test. Now, in today's healthcare, many tests are done at the patient bedside. For example, you must be aware of capillary blood glucose. Used to detect capillary blood glucose by glucometers. Now, ideally, these should be separate for each and every patient. Sometimes that is not economically possible. So, hence a single glucometer is used for many patients. That can also be a source of transmission of infection. So, every time you use this sort of instrument on a patient, you must disinfect that instrument before using for the next patient. Okay. Now, coming to the last part is biomedical waste. Now, what is waste? Waste is anything which is not intended for use further. In the hospital setting, we call it as hospital or healthcare waste. It includes garbage, refuse, rubbish, and biomedical waste. Then, what is biomedical waste? Garbage, refuse, I think you all know all these things. Biomedical waste is a waste generated during diagnosis, treatment, immunization of a human being or animals, or in research activities pertaining to or in production of testing biological matter. So, in short, anything related to human or animal or any biological is biomedical waste. Now, why it is important? You must have heard about the term hazardous waste. Hazardous waste means a waste which is a hazard for human beings and the environment. Among the hazardous waste, one particular hazardous waste is biomedical waste. Now, coming to healthcare waste, what does it contain? It contains infectious agents and toxic or hazardous agents. For example, mercury. They are very commonly used in thermometers or sphygmomanometers. That is a hazardous chemical. Sharps, needles, glass, broken glass, they are also. Then genotoxic agents. In pharmacology, you will read many medications which are genotoxic, teratogenic, those drugs. In radiology department, many chemicals are used which are radioactive. So all these comprises healthcare waste. Now, if we look in broadly, we'll have general waste, that is, people are there, they will have food, so there will be general waste from kitchen waste to paper waste. Other would be pathological waste. Then infectious wastes, sharps, pharmaceutical wastes, chemical wastes. For example, any chemical that is used for cleaning and disinfection, those are all part of the chemical waste and radioactive. So these are the 7 categories of waste that is generated in the hospital. So a study shows that on an average, an Indian hospital generates about 1.5 kg of waste per bed per day. Okay, so if you have say a 500 bed hospital, so you are looking roughly around 750 kilogram of hospital waste every day. So that's a huge uh, waste burden. Now, why should we be concerned? The main concerning part is that from the hospital, we are directly concerned about spreading of diseases like HIV, hepatitis, tuberculosis. All can be transmitted through this waste. Other aspect would be if you put everything in the drain or bathroom, what will happen? It will come out from the sewage disposal and ultimately contaminate the environment. Other aspect would be people getting infected directly from the hospital, or sometimes in many settings these waste are burned. All waste should not be burned. Suppose there are many types of chlorinated particles in the hospital waste. If you burn them, what will happen? That chlorine will be liberated into the atmosphere. And inhalation of chlorine is a very dangerous thing that will cause air pollution. And if you do not treat this waste and dump it in open landfills, what will happen? Rag pickers, animals will gain access to it and they will get injuries and other diseases. And a very important aspect is open landfilling may also lead to reuse of medical equipment like syringes, catheters. That's a very dangerous part. There are many diseases which can cause. I'm not going to details of that. Now let us come back to what are the sources of healthcare waste. Obviously, hospitals, be a government hospital, private hospital, it could be nursing homes, physician's office, a dentist office, or it could be dispensaries, or it could be mortuary, blood bank and collection centers, laboratories, animals houses, and even research organizations. All these come under biomedical waste. Now, who are the people at risk? Obviously, people involved in healthcare activity like doctors, nurses, paramedical waste, workers who are involved in disposal of this waste. Obviously, they are also involved. And I've already told you, if you dump it in open landfill, general public and scavengers react because they are also exposed. Now, having understood the problem, what is the solution? We need to dispose of the infectious and hazardous part. Why? See, I've already told you the huge chunk of the hospital waste that is generated is not infectious. Only a small part is infectious. So, what we need to do is that we need to treat the non-hazardous waste separate and hazardous waste separate. Okay. Among the hazardous, we need to segregate into infectious, radioactive, and chemical waste. If we do that, the main problem is solved. If we do not segregate, what will happen? Our whole waste will become infectious. Whole waste will become hazardous. So this is given by the biomedical waste management rules initially set up in the year 1998, further amended in 2016, 18, and 19. So what we need to learn is what are the existing protocol for disposal of biomedical waste according to the Biomedical Waste Management and Handling Act by the Government of India. So it has got 5 guiding principles. So what are the 5 guiding principles? That is the polluter pays. So when you try to treat the waste, the process will need funds. Now who's going to pay for it? The concept is the polluter pays. That is the hospital who is generating the waste. Next concept is precautionary principle. Precautionary principle means you need to act before it becomes a problem. Duty of care, it should be done at the site. Next, proximity. All the waste should be segregated and disposed as close as possible. Suppose you set up, our hospital is over here. Okay. So we need to come or we need to dispose our waste to the common waste management facility that is nearby Bolpur. We cannot make arrangements for waste treatment for a waste treatment facility in Kolkata. Okay. So that is proximity principle. And finally, the concept is cradle to grave. Cradle to grave means from point of generation to point of total disposal. It should be taken care of. Obviously, it does not involve other like radioactive waste, chemical waste. Those will come under separate act that is present. Okay. So, what would be the steps of disposal? First is identification of the areas of waste generation. You need to identify which areas generate most maximum amount of waste. Is it the wards? Is it the ICU? Is it the surgical areas? Or is it the outpatient? Next, you need to categorize the waste. I'll come to the categorization and quantify. Why we should quantify? Because if we don't quantify, we cannot reduce. I think you have heard about a thing called people who are trying to lose the weight. First, you need to measure your own weight, then act on various activities to lose the weight. If you can't quantify, you cannot reduce. Then minimization, that is, you should try all your activities so that the waste generation is minimized as much as possible. Then in the hospital, you must segregate the waste and store for a temporary period of time till it is collected by the biomedical waste treatment facility, where it will be treated, destroyed, and disposed of. So, how we should categorize? We will have this kind of bin with this level. This is the level of biomedical, that is the biohazard level. We need to store the waste according to the category and weight. Then these waste should be transported from, say, ward or ICU into the common central storage area in the hospital, from where it will be collected to the waste treatment facility by separate vehicles of central waste treatment facility, not other municipal vehicles or etc. Separate specific vehicles for biomedical waste. So, at the biomedical waste treatment facility, what is done after it is collected from the vehicles? They might be autoclaved, incinerated, recycled, or treated, or secure landfilling is done. Okay. At every point of time, from the point of generation till disposal, all containers, be it the waste container or the vehicle that is used for transportation, should have this symbol of biohazard. And if it is carrying cytotoxic material, the cytotoxic sign. All people who are involved in transportation and disposal should be given personal protective equipment. I have already told these things. Okay. Now categorization comes under 4 parts. First is the blue container, white container, red container, yellow container. They will have their own separate, that is, non-penetrable bags, the same color coded bags. There will be another black bag with the sign of cytotoxic for cytotoxic drugs. These are the pictures how people. Now coming to categorization. What kind of waste should be disposed of in what kind of container? First is for the yellow container, the waste would include human anatomical waste. What are the human anatomical waste? Like placenta from the labor room, or the surgical samples that is sent out for pathological examination, or any surgically resected samples. Animal waste used for any research purposes or any other purposes. All the gaugings, paddings that are used, blood soaked or secretion soaked, all expired medications. Please remember, cytotoxic or radioactive material should not be put. Okay. They should be collected in the yellow bin, stored, and sent to the treatment facility where it will be either incinerated or undergone plasma pyrolysis or deep burial. The best way of disposal is incineration. Okay. So when you are incinerating, please remember any chlorine containing, be it a plastic container or anything like hypochlorite solution, please do not put in the yellow because it will be ultimately incinerated, and if it is burnt, fluorine glass will be liberated. Okay. Now, another aspect of yellow disposal in yellow category is all the laboratory waste. Please remember, laboratory waste are infectious until and unless proved otherwise. So, how we must use them? First, in the laboratory itself, we must use the autoclave to render it non-infectious. Then only we send it out to the common storage facility in the yellow container. Okay. For all other, we take the waste, put in the yellow container, and send to the common central storage facility. But laboratory waste must be autoclaved first and then sent. The last part of the waste in yellow container is the chemical waste. Either your hospital or healthcare setting should have a waste treatment facility for liquid waste, or it should be collected separately and sent to the treatment facility. Coming to the red category, what are the things that should be disposed of in red category? All the tubings, be it a saline fluid containing jar, tubes, catheters, gloves, all these things should be put in the red container. And to prevent reuse of this material, ideally you should mutilate it at the point of disposal. How to do that? For example, you have given a patient a saline infusion, you have used it up, now you are trying to throw it away. Just with a big scissor, cut the tubings and then dispose of. If you cut it, it will not be reused. Okay. How it is treated? See, generally these plastic materials used or made with plastic, they are recycled. Okay. Next comes to the white category. The white category is used to dispose all sharps, including needles, blades. Okay. Now, because they are sharps, people might get sharp injuries from that. So, this is not a plastic bag. Rather, it's a puncture-proof container, white in color, so that it is not injurious to the person who are collecting the waste. Never dispose of needles or sharps in yellow or red container. Always in a wet container. Now, what is it done in the central treatment facility after autoclaving? Either it is put in municipal secure landfill or it is encapsulated with cement. So, okay. Last part is the blue category. In this blue category, what is disposed of? Glasswares and metals. Why they are disposed separately? Because both are recycled, but by the people or the companies who are manufacturing them. So you need to collect them in the blue container from the waste treatment facility after it is autoclaved. Glasses will be recycled and metals like implants will also be recycled. Okay. So these are the categories. Now important parts is generate waste when it is essential. Why this is important? Say you are the on-duty doctor, a patient is having fever, and you are intending to give him, say, paracetamol. You can give him by a oral route or you can give him by a IM, intravascular. So when you have an opportunity to give it by the oral, you are actually generating less waste as compared to a intramuscular injection. Okay, because when you are giving a tablet, what will happen? The tablet will the wrapper that will go to the general waste. But when you are advising the nurse to give an intramuscular injection, she will open a needle with the syringe, will produce not only general waste but also sharps and plastic waste. Next is segregate as soon as possible. If you don't do that, the whole waste become infectious. Third, collect the waste in specific color coded. Otherwise, it will become very dangerous. If by mistake you throw a used needle in a yellow bag, what will happen? The person who is collecting the waste have a high chance of getting injury through that needle. Then you must, as soon as the solid waste is generated, plastic waste, it should be mutilated to prevent the reuse. Needle should be destroyed with needle cutter. The bin should be regularly washed with soap and water. Also remember, hospital also generates municipal waste like fruit peels and other waste. Those should be kept separately and treated as municipal waste. They should not be thrown in biomedical waste bins. Then the transportation should be done in closed container, and the transport should be done in a predefined route, not using the area used by patients and visitors. So, what are the important don'ts? Never mix infectious or non-infectious waste. Never mix chlorinated materials in the yellow bag for incineration. In the bins, whenever it is two-thirds filled, send for the storage. Never store beyond 48 hours. That means your bin should be transported and cleaned at least once in 48 hours. Then keep in mind there should not be any spillage on the way to the transport. And finally, avoid transport through the crowded areas. Okay. The role of doctor is to teach everyone about all these things and to practice them. And more importantly, there should be a hospital infection control committee monitoring the biomedical waste management. Okay. So those are separate things. I'm not going to the details of this. Well, that's it.